Welcome to the picture mnemonic for Campylobacter jejuni. In this video, I will give you the information about the Campylobacter jejuni and we will try to remember it easily with this picture mnemonic which I have drawn here. So let's first talk about the properties of Campylobacter jejuni. So Campylobacter jejuni, it's a gram-negative organism, right? And this is motile. The transmission of infection is by fecal-oral route, and mainly this is acquired by drinking raw milk, right? And this causes diarrhea, or it can also cause dysentery. Okay, it can also mimic appendicitis. It just mimics appendicitis because it affects the large bowel. Okay, so this is a large bowel, right? Imagine this is a large bowel and there is a cecum and there is a colon here. So if there is an inflammation, there's an inflammation in this part, okay, there will be pain in this region, okay, mostly where the appendicitis pain occurs, that is McBurney's point. So it may mimic clinically that patient is having appendicitis, but with further tests, that is by USG or CT scan, you can find out that appendix is absolutely normal and this disease is Campylobacter jejuni, which is mimicking this appendicitis. Okay, so this bacteria can uh, be so sharp that it can fool the doctors, right? So yeah, in clinical practice we face all these challenges, so we should know each and everything as far as possible, right? So it can also cause arthritis, okay, and septicemia if the infection is not controlled in time. So, and the treatment is aminoglycosides and supportive treatment. Now this releases enterotoxin, which is heat stable enterotoxin, and this behaves like that of Shiga toxin. Okay, so similarly, like Shiga toxin, it destroys the cell, okay, and it can cause ulcer in the intestine. So now let's correlate every property. You can see that I have drawn the two bacteria here. Okay, this is a, let me explain you the scene first. Okay, this is a campfire scene. You can see this is the night time. Okay, and this bacteria is the mother bacteria. This is the mother bacteria, okay, with a glass of milk, and you can see this small bacteria which is probably her child, okay, and he's instead of drinking this milk, he's eating this cotton candy, and you can see that I have drawn the cotton candy similar to that of uh, large bowl. Okay, you can see that it similarly looks like this part. Okay, so I have intentionally did it, okay, so that you can remember that this is the cecum part of the colon and this is the appendix. Okay, then I've drawn this campfire scene, and there are birds here, and this is the night time. Okay, now let's remember everything. So with this campfire scene, you can remember the name Campylobacter jejuni, right? Campylobacter jejuni, right? Now they are gram negative. So how to remember it easily? You can see I have drawn this bacteria in a pink color. Okay, so this will help you remember, because when we stain the slide of bacteria and with gram stain, okay, and if it is gram negative, then it will mostly comes out as a pink color, okay, under the slide, and if it is gram positive, then the color of the bacteria will be purple. Okay, then you can see that this mother bacteria is giving this milk to her child. Okay, so this will help you remember that transmission is by fecal-oral route, okay, and most probably with raw milk. And this cotton candy will help you remember that this mostly affects the large intestine, and it can also mimic appendicitis, okay, with this appendix figure you can remember that it mimics appendicitis. It just mimics appendicitis, and it affects the large bowel and can cause diarrhea, right? Then this red strips which are drawn inside, this will help you remember the ulcer. Okay, this Campylobacter jejuni can also cause ulcer. So basically this bacteria is eating our intestine. Okay, so this way you can remember. Then this flying birds will help you remember the feature which is motile. So this way, this is the easiest way in which you can remember the whole Campylobacter jejuni. Okay, with this very simple picture. So yeah, that's all for this video. If you have any doubt, then comment in the section of comments, and please don't forget to like, subscribe and share this with your friends. Okay, so that's all for this video, and